let's dive in. I have lots of information for you today. And if anybody has any questions, if you want to put them in the chat, and then I can answer them at the end. Sound good? Okay. So for today, I'd like to share with you some information where it will help you recognize the signs and symptoms of PMADS, which is perinatal mood and anxiety disorders, describe at-risk populations, get some new resources to share with your clients, and improve perinatal screenings. Little fun fact, the CDC came out with this in 2019, that 41.2% of people are having pregnancies that are unplanned, which is pretty significant if you think about all that goes with that mentally. So again, in the world of perinatal mental health, a lot of people recognize it and say it as perinatal mood and anxiety disorders, or PMAD. So if you ever hear that, and then also MMH, maternal mental health, just because there used to be this umbrella term of postpartum depression for everything. So that's why they changed the language, right? So when we say mood, we're talking about depression, bipolar disorder, psychosis, and then something that probably most of you have never heard of is the dysphoric milk ejection reflex. And then anxiety, generalized anxiety disorder, OCD, and then post-traumatic stress. And I'll be talking about all those today. Oops. Uh-oh. How do I go back now? Oh, geez.
You should be able to do your arrow back.
You got it.
Oh.
Or you can restart your share. Yeah. No worries.
Okay. All right. So some facts to share with you guys. Mental health issues during pregnancy is the most common complication.
Oh, I don't think you are resharing again. Now you just have to reshare again.
Your time.
Yeah. Perfect.
Okay. So yes, so mental health issues like depression and anxiety are the most common complication of childbirth. And when I say that, that compares to gestational diabetes, gestational hypertension, obesity. It's due to the fact that there's changes in the biology of a woman, psychology, and also the environment. We also know that suicide and overdose are the leading cause of death for women in the first year after pregnancy. It can lead to mother and infant attachment issues, and then negatively impact the bond between mother and a baby, and also the infant's development. And that we know that sleep is probably one of the most, if not the most important modifiable risk factors for postpartum psychiatric disorders. There we go. So in the first 6 months, 3 to 6 months of the postpartum period, 1 in 5 women will experience a mental health issue. And then within the first year, 1 in 7 moms will experience depression or anxiety. We also know that 1 in 10 dads will experience postpartum mental health issues. And then also some of the research that was coming out after the pandemic was even saying that it was 1 in 3 birthing people having mental health problems. Also, there's not a lot of good research for the LGBTQ communities, but we do know there's some research in the UK that showed that lesbians are the fastest growing population receiving maternity care. There's increased risk for mental health issues with this population, also an increased risk of attempted suicide. With the transgender population, we know that now that there's men that are, involved in having babies. Transgender people just, they have increased risk of depression and suicide rates in general. And then you throw the pregnancy in, so it will increase the risk of anxiety much higher than other populations. And then also we know with non-gestational parents, they also experience mental health issues. So 27% of people will already have a chronic mental health disorder going into the pregnancy. 33% will develop it during the pregnancy, and then 40% will develop it during the postpartum period. But the most interesting thing is that 75% of these people are not seeking treatment at all. Again, it increases the risk of like long-term complications to like the family unit and the infant. And if left untreated, it can last for up to 3 years. Which is interesting because depending on who you talk to about what postpartum means, is that is that 6 weeks after you have a baby? Is it the first year? So even going in to get help, if you do have a mental health issue, it's not very clear. Is it a postpartum depression or anxiety, or is it just generalized anxiety? It's very blurry. And individuals of color and individuals of low income are more likely to experience PMADs, and they're less likely to be able to access care to receive help. So when I was in nursing school, we only had
Erica, I'm sorry. You said PMADs, is that the right lingo that we should be using? PMADs?
I mean, it depends on who you talk to. There's a lot of people in the field will recognize it as PMADs. Again, perinatal mood and anxiety disorders.
Yeah, no, that's very helpful. Yeah,
or MMH, which is maternal mental health issues or conditions, or psychiatric disorders. It's
okay. Thank you. Okay.
Yeah, so when I was in nursing school, I had 2 paragraphs in my textbook about mental health. And the first topic was, what's the difference between baby blues and postpartum depression? And then another paragraph was on postpartum psychosis. And I will tell you that obstetricians have very little training as well in recognizing these things. They don't get a lot of education on it, at least historically. They haven't. Maybe that is changing now with like younger generations coming out and being more exposed to trauma-informed care. But yeah, they really are not very educated on what to do with these people that have mental health issues. But baby blues, again, it will affect up to 85% of people. So it's very common. It's normal. You know, they'll start crying. There's weepiness. They'll feel overwhelmed. It's due to changes with their hormones. And it does resolve within usually 2 weeks, 2 to 3 weeks, they say, after childbirth, right? Anything after that point is considered abnormal, and they should be reaching out to talk to their doctor about their mental health. So with postpartum depression, 14% of people will experience this. There's a bunch of risk factors, obviously a history of it. If anybody has like PMDD, the premenstrual dysphoric disorder, or we know it as, PMS, significant PMS. And you could read the rest of these. It's a mom that has a baby that goes to the NICU, or somebody that has multiples, people that go through infertility treatments, people with diabetes are affected, thyroid imbalance, breastfeeding difficulty is a big one. Single parents, younger parents, and then babies that have trouble sleeping and intimate partner violence. Signs and symptoms, I'm sure you guys are all very aware of them. Changes in their diet and sleep and energy and motivation, feeling guilty, being irritable, angry, and rageful, or feeling overwhelmed, and then a lack of interest in the baby and not taking care of themselves. And we'll see intrusive thoughts too there. Anxiety disorders, 6 to 8% of people will experience those. Risk factors, again, include family history, history prior to pregnancy, and then thyroid imbalance. Signs and symptoms, similar to regular generalized anxiety disorder, feeling stressed, worried, overwhelmed, having shortness of breath, dizziness, hot flashes, feel like they're going crazy, again, having intrusive thoughts or harming the baby or themselves, and then difficulty falling or staying asleep, even if the baby is sleeping. They just can't relax. Obsessive compulsive disorder can occur, about 4% of people having babies. Obsessions, you guys know what those are. Disturbing, repetitive, intrusive thoughts, which they will always have around either harming themselves or the baby. These thoughts can cause the individual a lot of distress, which makes this a thought that's ego dystonic, right? So during pregnancy, a lot of the thoughts are around the baby dying and also contamination. And then in the postpartum, usually it's around harm to themselves or the baby. And with the compulsive behaviors, they will be checking or attempting just to have a behavior to make the thought stop. Signs and symptoms, they have a sense of distress over these obsessions. They become hypervigilant. They don't like to be left alone with the baby. But I always tell people that one of the biggest things that they could recognize when they're so scared that they're going to do something harmful is that they know that it's an irrational thought and they really are afraid of it, versus somebody that is psychotic. They think their thoughts are rational, right? So when people are scared, like they're going crazy, with these thoughts, like what's happening to me, whenever they say that they know that the thoughts are irrational and that they're afraid that this is going to come true, like that usually makes me feel better, because that tells me that they're again, that this is ego dystonic versus, what's the other one, ego syntonic. You guys are therapists, you should.
Yes, ego syntonic. You're perfect.
So syntonic, yes. So post-traumatic stress disorder, 14% of individuals will experience this during having their babies. There's a change in cognition, mood, arousal associated with a traumatic event that happens. They could become avoidant of things associated with that traumatic event, feeling restless, keyed up or on edge, and it can develop due to birth trauma. And one of my doula clients, actually, she hired me for her second birth. She was so terrified to have another baby because when she went in to have her first, it was during the pandemic and she was in so much pain for like 24 hours and nobody addressed it. They just told her she was in early labor and she had to deal with that. And so the thought of having another baby scared her. And then when she got pregnant, the thought of being in pain scared her. And anytime she'd drive by the area of where the hospital was, she would have like a major panic attack. Which, this affected how she interacted with her baby. It affected how she experienced her postpartum period with her baby and her husband. And then it took them a really long time to get to a point where they were going to have another baby together. She wasn't really ready, but it happened. So signs and symptoms of post-traumatic stress disorder, intrusive symptoms that they're experiencing of distressing memories, dreams, or flashbacks, prolonged stress or physiological reactions where they'll sweat, feel nauseous, they'll tremble, alterations in arousal or reactivity, so becoming hypervigilant, irritable, the inability to concentrate, inability to sleep, and then they avoid people, places, thoughts, feelings, or conversations associated with the trauma. And again, if you think about somebody with PTSD where it's around the birth of their baby, it's like every year of the birthday, it's also a date that symbolizes trauma to them. So it can be very triggering. It's a very big conflict for these people to feel happy, but then also go through these triggering PTSD symptoms. So when I say birth trauma, what does that mean? So it's the person's experience of interactions or events that are directly related to their birth experience that cause overwhelming and distressing emotions. It's really their perception of the experience, right? So like from my experience as a nurse, I could think, yeah, that was like a really good birth, but to that patient, she may have thought for 1 minute during her labor that the baby was in danger, and maybe nobody educated her properly. And then, that stuck with her like into the postpartum period, right? Where in that moment, she felt like her baby was unsafe and something was going to happen to it. And that could have been her perception. So, there could be a doctor, a father, a nurse, and the patient all in the room, and they could have totally different experiences. But 33% of women will report that they feel traumatized by their birth, and 20% will feel like they've experienced some type of mistreatment during their pregnancy or birth. Women of color have an increased risk of obstetrical complications, and they're more at risk of receiving poor interpersonal care. And then birth trauma could lead to, a whole range of other mental health issues. So for birthing, things that could lead to trauma for the person or the infant. So significant physical injury, if anything happens, or just the threat or fear of injury or death. So obstetric interventions or complications. So if you look to the right, there's a whole bunch. Like anybody that has an emergency C-section that has to be put under general anesthesia will definitely have some type of trauma. Using forceps, a vacuum, having a 3rd or 4th degree laceration, anytime manual removal of the placenta, that can be really painful for somebody. That could be really traumatizing. And then also, a stillbirth, any fetal distress, and then the baby going to the NICU could cause trauma. Some physiological factors, just having this prolonged fear or terror related to a personal experience going into childbirth. Some examples, again, like anybody who had previous like interpersonal violence trauma, any childhood traumas. And then for people of color also, being incarcerated during labor, there's stories of that. Hitting a nerve when they're getting an epidural, that could be really scary for women. And then threats to psychological safety brought about by negative interactions with providers or the healthcare system in general. So a lot of women will actually experience trauma because they felt like they were not in control of their body, or that people were talking about them like they weren't there. Feeling abandoned or alone, being yelled at or ignored, poor communication, and then a lack of like informed consent. Oops. So with bipolar disorder, sorry, I keep having to move my screen of you guys. Bipolar disorder occurs in about 3% of people having babies. Criteria is that if they experience manic symptoms for more than 4 days and it interferes with functioning in relationships, they would consider it during this time. Many women will be diagnosed with the first episode because of being pregnant. They never had an episode prior to this experience, and the hormones just set it off, trigger it. And the biggest risk factor is the lack of sleep that they experience in the postpartum period, which leads into psychosis, because the majority of people that end up with postpartum psychosis really do have bipolar disorder. So they either have had postpartum psychosis with like a previous pregnancy, or it's the first time they're learning that they're having bipolar. And it's triggered again by the lack of sleep, where they're not sleeping for a couple of days, and it triggers them. 1 to 2 women in every 1,000 will experience psychosis. 23 times more likely to experience in the month following childbirth than any other point in a woman's life. There's a 4% infanticide risk during this time and a 5% suicide risk. Again, it usually happens very quickly, very suddenly, within the first 2 weeks of childbirth. However, it can happen within the first year. I worked at Alexian Brothers Behavioral Health Hospital prior to this position. And I think about 6 months ago, perhaps, we had 3 postpartum psychosis patients in the hospital at once, which was very surreal to me to see that. Like, I wouldn't have thought that would be such a normal thing to see at that time, and to have so many of them. Again, risk factors: sleep, family history of bipolar is also like a major one, or a previous psychotic episode. Postpartum psychosis is a medical emergency. The person will have delusions, hallucinations, paranoia, rapid mood swings, cognitive impairment, a focus could be on death, impulsive, reckless behavior. And again, these thoughts are considered egosyntonic. So they're not distressed by the thoughts. They believe them. And the mom should go to the hospital, go to the emergency room to be treated for this. I'm not sure if anybody's heard of dysphoric milk ejection reflex, or it's called DEMER. It's a condition that affects lactating women that's characterized by abrupt dysphoria or negative emotions that occur just before the release of milk. And it only occurs for just a couple of seconds to a couple of minutes, but it is so intense that people feel such depression and sadness and irritability, that I've heard of people actually going to the hospital to get help for this, because it's just every time that they lactate, they go through this emotional experience. What they found is that it's linked to an inappropriate drop in dopamine levels when the milk's released, which causes the negative emotions. Comes on suddenly before the letdown of the milk and leaves within 30 seconds to 2 minutes. It can happen for the first letdown of a feeding or all of them. And then it may or may not help with pumping. So some people, it could self-correct within the first couple of months. I think I meant to put by month 9, I think, moderate. And then somebody that has it severely will experience it for the first year or longer. So there is another morbidity and mortality report that's come out since this one, and I apologize that I haven't updated it, but it's interesting to look at because in 2017, they found that 103 women in Illinois died during the perinatal period. Black women were 3 times as likely to die from a medical complication, where white women were more likely to die from a pregnancy-related mental health condition. And that 85% of the women had deaths by suicide, and 35% there were drug overdoses involved. And the final statistic for this is that 83% of these deaths were preventable, according to IDPH. So who is our at-risk populations? Pretty much everybody. Anybody with a family history of mental health, people of color, people that have low income, live in the low income neighborhoods, military women, veterans, immigrants, again, parents with babies in the NICU, anybody that doesn't have a social support system, and then people that have had a history of trauma. So consequences of untreated mental health issues. For the moms, again, they could not be taking care of themselves, have poor nutrition and self-care. There's increased risk of substance abuse and interpersonal violence. They're less responsive to their babies. They have a higher risk of separation and divorce. Higher chances of disability and unemployment, increased risk of suicide and homicide. And then to the babies. So they do know that there is a neurobiological mechanism of stress that's transmitted during pregnancy to the baby, and that could impact the child's stress response, self-regulation, and attachment into adulthood. But some of the more short-term consequences that we see are low birth weight or preterm birth, longer stays in the NICU. These are babies that are really colicky and they cry a lot. Impaired bonding between the parents and the babies, increased risk of neglect and abuse, and then behavioral, cognitive, and emotional delays seen in children, and also an increased risk of infanticide. And all of these things can lead to an increased cost of medical care and inappropriate medical care. So with fathers, they see that it's twice as common in new dads. The incidence spikes at 3 to 6 months, which actually is, it spikes also around 3 months for women too, right when they go back to work, right? And there's a growth spurt during that time with babies, and they decide they want to stop sleeping around that time. At least a high percentage of them do. So dads will show irritability, anger, aggression, frustration, which could lead to them withdrawing, becoming avoidant, increased risk of substance abuse. There are reports from fathers where they have lower levels of affection towards the infants, and they experience higher levels of criticism from their partners. And also, we know that the Edinburgh postpartum depression screening scale is also validated for dads, and that they present with lower scores compared to women. Risk factors for dads: having a personal history or family history of mental health issues, again, lack of social support. There are changes in hormonal levels with men too. A lot of them are issues surrounding the baby. Again, if they're in the NICU preterm, have low birth weight, difficulties bonding with the baby and maybe even the mom. And then also concerns with the partner. If the mom has depression, there's an increased risk of the whole family to experience negative effects of that. Any kind of complication during childbirth, if they witness a traumatic birth or there's an unplanned C-section, the dads experience a lot of emotions around that as well. And then having relationship conflicts could be a risk factor. So with dads, what they see is that there can be an increase in their hostility with their partner in the home. They might feel resentment towards the baby or the mom, negative parenting, or they might have a little bit harsher discipline towards the child. And then children's behavioral, emotional, and conduct problems could increase due to the relationship conflict. And then also, the consequences can decrease positive engagement with the baby, where they're less playful and warm, less of a detached style with their child. Might see a decrease in positive interactions with older children, with reading, singing, playing, just engaging with the child. And that there's also a decrease in adherence to safety guidelines with safe sleep and car seat usage. There's some racial and cultural considerations too. We do know that women of color are 3 to 4 times more likely to experience complications during childbirth and pregnancy, and they're more at risk of dying from these complications compared to white women, which was the case in Illinois in 2017 with that report came out. Intergenerational trauma is something that they experience, and also institutionalized racism, where they experience that within the healthcare system. So some of the screening tools that are used, we usually in the OB world, they use the Edinburgh postnatal depression screen, but the PHQ-9 could be used, and ACEs would be a really good one to use when it comes to trauma and their childhood experiences and what they might experience after childbirth or during childbirth. ACOG, that's the American College of Obstetrics and Gynecology. They recommend that these women are screened once during their pregnancy and then again in the postpartum. And then the American Academy of Pediatrics also recommends doing these depression scales at the 1 month, 2 month, 4 month, and 6 month well checks for the babies, where they hand those out to the moms. Is it enough screening? I don't know. I don't think that when the moms go to their pediatric appointments for their babies, they're not really thinking about themselves in those moments. And from what I've heard, and I don't know if you guys have had any experiences yourself, but nobody actually sits down and talks to people about how they're feeling. They basically hand the screener over and ask you to fill it out, and then they take it, and then that's it. So I don't know if the system works, but this is what we have for now. Things that we can do to help women is to use, and birthing people and dads and partners, is to use an integrative approach. They found, some studies have shown, diets obviously with more nutritional value, with fish and seafood and fruits and vegetables, can help with mood. Incorporating folate, that helps prevent neurotube defects in babies and cleft lips, cleft lip, and cleft palates, right? So giving the mom the folate could help with that. Omega-3 fatty acids, there's a lot of research that showed an improvement in mood from taking that. Using mindfulness, getting light to moderate physical activity, sleep is a huge one, making sure that they're getting enough rest during that time, which is the hardest thing, I think, for couples. And then bright light therapy has shown some benefits as well. So just some different referral resources that you guys should know about. Postpartum Support International is an organization that offers free resources to families and provides education to providers on perinatal mental health topics. They offer this psychiatric consult line that came out a couple of years ago, which is 100% free. So a provider could call the hotline, and at the time they had like 16 different people a couple of years ago. And within 24 hours, as long as it's not an acute situation, the psychiatrist will call the provider back, and they offer support for anybody that's of conception age all the way through postpartum period. And they will help diagnose, treat, and manage these people. So it's a fantastic resource for people that don't know what to do. But also, Postpartum Support International, or we call it PSI, they do have a provider directory for people that have specialized knowledge in just perinatal mental health. A couple of years ago, we know that they came out with 988, the National Suicide and Mental Health Crisis Line. Around the same time, there were two other hotlines that came out. PSI, they had a warm line at the time to help people, but they came out with a hotline. And then also the Maternal Mental Health Hotline, which is help for moms. Oh, sorry about that.
It does that sometimes.
Some other information and resources, there are like the Maternal Mental Health 101. It's a free 90-minute complimentary webinar from PSI that they give to help train people. I know that 2020 Moms offers one as well. It's just to help get people more educated on the topic. There's plenty of webinars too with these two organizations. Actually, these two, and then MMHLA, which is the Maternal Mental Health Leadership Alliance. That organization has really awesome fact sheets that they've created for postpartum psychosis and like Black African American moms and birth trauma, all very specific, right? Postpartum Support International offers a certification for perinatal mental health. It's really not that difficult. You have to, get a certain amount of continuing education, go through their training, and then you take a test, which is something that I did when I was still a nurse. Resources for questions about medications during pregnancy and lactation. I think this is one of the most important ones. And Mother to Baby is an incredible resource that you could go on, and they have all kinds of exposures to a woman that's pregnant and lactating. So chemicals, different kinds of exposures, but that includes medications. And they have these really concise fact sheets for individual medications in English and Spanish, and it will provide you with, the most current evidence that is out there in regards to the risks involved with taking that medication and being exposed during pregnancy or through lactation. So I love that to give to people because it's very simplified and it gets right to the point. And then they can make a decision if they want to take medication or not during their pregnancy, because it's always about risk versus benefit when it comes to the birthing person. And then the Infant Risk Center is open 24 hours, I believe, and you could literally call. I remember I was at the dentist and I had something they were going to give me. I wasn't sure if it was safe. They were telling me not to breastfeed for like 24 hours. So I called the hotline and I checked in with them while I was at the dentist. And I said, could I take this medication? I'm breastfeeding. And they told me right over the phone, yes, it's safe. You can go ahead and do it. So I mean, a lot of providers will just tell you just to be on the safe side, just pump and dump for 24 hours or whatever, when most of the time women don't need to do that, which could cause a lot of complications over that 24-hour period, right? So it's good to get the right information from the people that know. And then Massachusetts General Hospital has a really big program in regards to maternal mental health. They do a lot. They are doing studies on people that happen to be taking medications while pregnant, and then the patients will submit information like after the fact. So they've been helping collect a lot of information with this population that way. And they also do virtual rounds. So anybody could join, and it's people from all around the country, and they have case studies. And it's very interesting if anybody wanted to find out more. And that is it. All right, so let's see if you guys have some questions for me.
We had Danielle and then Sarah S., I believe.
Okay, are people who prior to pregnancy have anxiety and or depression more likely to experience postpartum symptoms? Yes. Yes, they are more likely. They are. Is Danielle still there?
I'm here.
Do you have anything else that you wanted to know?
No, you gave it directly to, I was looking for a yes or a no.
And actually having pregnancy related anxiety, yes, that's like a huge indicator that they will experience postpartum depression. It's a risk factor, yes. Okay.
And just to speak to that, I think we have a lot of clients who have a lot of pregnancy related anxiety, and just knowing there will be a higher chance of having postpartum will just lead to anxiety and hopelessness. But actually using this to guide, all this tells us is planning your support up front and being proactive. So how do we take the data that we have of increased likelihood of occurrences, and then now you could create a roadmap for yourself, and we could plan for check-ins. Let's not wait. And if anything, you'll just have more support from the beginning. So I think taking that really important information and then helping a client go from doom and gloom to, so therefore what do we do with this information? I don't know, Eric, if you have it, like, are there ways someone can be proactive and try to set themselves up for success or less suffering?
Yes, I mean, there's research that shows that people that have doulas have better birth experiences and have better postpartum experiences. And insurance companies are starting to pay for doula services, which is amazing. And hopefully everybody should have a doula, because doulas offer emotional support in addition to the physical support, right? Like the emotional component is the biggest thing. But so like doula services, having a therapist. If anybody that I know doesn't, I always ask them, do you have a therapist just to have on call? Like go see somebody ahead of time, even if it's just once, just so you have somebody in your back pocket, right? But having a lactation consultant, like having all of the information ahead of time, so that way somebody does become overwhelmed in the moment, they have all the information right there. But just, yes, coming up with a plan of like, how will we handle this? You know, like what, you know, making sure the partner knows and is involved, right? Relationship counts, like relationship therapy should be like a part of like the component of having a baby, like learning about like, how is this going to impact our relationship when this baby comes? Because a lot of people don't spend any time thinking about postpartum. They think about becoming pregnant, and then they think about like, what's labor going to be like? What's going to be like when I'm holding my baby? And then they just wing it. They like go home with this baby and they're just like, we'll figure it out, you know? And that's the hardest part is that. So, you know, getting the partner involved and like kind of talking about like what the relationship might look like and how they could support one another, how things might change in the house. Did that answer your question? Deborah, did your hand
Sorry,
up?
I didn't mean to raise my hand, but that was really hopeful and helpful and things that we can also support. So thank you. That was great.
And also another thing that I help people do is when I talk to them about like sitting down, having a conversation between the partners about how things will change, how they could support one another. Also, sleep is so big, right? So coming up with a sleep plan where like maybe the mom, just as an example, a mom, will feed the baby until about 7-8 o'clock, right? And then she'll go to sleep for at least a 4 or 5 hour chunk of time. And at that point, the dad will stay up and feed the baby either with breast milk that she pumps or formula. And I talk to clients too, that like at week 2, that's when milk kind of stabilizes. So after the first feed of the day, they could pump. They could do one pump session for 20 minutes, and that will get them usually enough milk for one feed. And the dad could start doing that after week 2 every night so that the mom could get a chunk of time to sleep. And then also going over nutrition, like making sure that they're eating right during that time, and self-care.
Since we are out